तेरे मेरे बीच में कैसा है ये बंधन अनजाना.
No, this is not an interview with a singer, but if you can believe it, the person you just heard is a doctor. Yes, who you heard is Dr. R. Balaji. He's an ENT specialist at Apollo Hospitals here in Chennai. He's our guest in Real Talks powered by Apollo Hospitals. So it's monsoon season and half the people we know they have a cold or they have some other form of flu. How would you differentiate between chronic sinus and just seasonal allergies?
Yeah, seasonal allergy is very common now. You can see every second patient and person is having some form of flu symptoms like running nose, sneezing. See, the symptoms, acute symptoms like running nose, sneezing, itching of the nose, and sore throat, these are all acute symptoms. This is caused by viral infection. So once this infection, keeps going on for over a period of 3 weeks, and if it crosses 3 weeks, that is what we call it as, 3 weeks to 3 months is subacute form. Anything above 3 months, 12 weeks is chronic sinusitis. That is called as chronic sinusitis. If it is in the acute form, many people get confused with the common cold and sinusitis. Almost both are same. See, what happens is sinuses are empty spaces in the face surrounding the nose, which has got its own secretion and it has got a small opening. See, the sinus, it's like a room which has got a small opening. When you get acute cold, this flu, what happens is because of this congestion, the sinus opening gets blocked. So what happens is, see, there cannot be proper ventilation to the sinuses because the opening is closed. So there is no ventilation. So what happens if there is no proper ventilation? All the secretion gets more thick, they get stagnated inside. In simple words, when it is watery, it is acute. When it is a thick phlegm, it is chronic, layman language.
Right.
So, but technically speaking, anything symptoms, if it's going to be there for a period of 12 weeks, that is 3 months, we call it as chronic sinusitis. Below that is acute or subacute.
How do we deal with it? Because there are a lot of home remedies that many of us use.
Yes.
Steam inhalation is one common one.
Yes.
That might give us some relief.
Yes.
But how do you deal with sinusitis for a long period of time?
If you develop sinusitis secondary to an acute viral infection, there are supportive measures like some medicines or, as you said, some homemade, home remedies like steam inhalation, all those things. When it is due to some anatomical problem, for example, person may be having a bent nose, septum. It may be bent on one side, which can come on the way of ventilation to the sinuses. Or there are some other structures there are technical terms, there are some concabulas, so we call, and sometimes they may be having a polyp. Polyp is a very common word, people know about it. In other words, it's anatomical. So if it is not anatomical, if it is due to simple cold, we can get away easily with simple medications. And of course, as you rightly said, steam inhalation is a big blessing. The thick secretions will be made thin, which will be easily traveling out of the sinuses. See, that's why if you see most of the sinuses, we call the sinus headache, we call it as office headache. So in the office, you get a lot of headaches, that is different. And this headache happens because of sinusitis. Typically, it starts in the morning. Of course, today, office hours is, some people work in the night and the evening. I'm talking about the standard
And some people work both in the day and night.
Night, yeah. We, of course, work like that. I'm talking about regular standard office work. What happens is, when they sleep in the night, all the secretion gets stagnated inside the sinuses. When they get up in the morning, the sinuses gets clogged with the secretion. And once it is full of secretion, it cannot expand further. So that causes pain. That sinus opening is blocked. So it takes some time to open that opening. Once it opens, all the secretion will drain out.
Right.
So it takes little bit of time in the morning. So that's why when they come to office, they will be having terrible headache. For a period of time, it may open up and drain all the secretions, which will give them a good relief. Why when you get sinusitis, the whole head feels heavy. Necessarily not a head-weighted person, but it's a face weight. Yeah. Headache need not be there. Still, you may have all other symptoms like stuffy nose. And the most important thing is postnasal dripping. People, you can watch some people, constantly clearing the throat. We call it as hawking, like they do.
Yes.
Sometimes you think that someone is calling you and you turn, but, they have their... And I mean, it was looking like a joke, but many patients come for this symptom. If you have a sinusitis, you travel in a flight. If the cabin is not pressurized properly, especially while landing, the moment pilot announces the descent, they need not even announce the descent. Your ears will tell you that the descent has started. The pain will be so intense, and you will feel that your eardrum is going to rupture. So what happens is the ear station tube doesn't function properly. It has to open and equalize the pressure. Because of the sinusitis, the postnasal dripping will affect the ear station tube function. So it cannot open. So the negative pressure builds inside. So there will be a lot of pain. So there are a lot of sequelae to untreated sinusitis. Because sinusitis has become a social disease nowadays. See, they say the incidence of sinusitis varies from 5% to 15%. But in India, 1 out of 8 person has got sinusitis, thanks to pollution, in our stress, because driving itself is a stress in our part of the AC blower, which is blowing onto your face, is one of the main cause for sinusitis, because it will directly affect your nose. It will cause congestion of the nose, which will lead on to the sinusitis. And I've seen people using AC and fan together, and that shouldn't be done. Yes.
But why do you say you shouldn't use AC and fan together?
You can see, you just after you just switch on the AC, after some time you switch on the fan and see, you will experience it. You can see one current, air current, one cold current and warm current will be coming. You can see suddenly hot air will come, cold air will come.
Yes.
That will affect the nasal cycle. That will cause nasal congestion. So that is why we recommend either fan or AC. AC means uniform temperature should be there. See, that is also, as I told you, what happens is when you are in the AC room, you are in a temperature of say 18-20. The moment you get out of the room, it's 40, double. So that causes a lot of changes in the nose. That is also predisposing to sinusitis.
Right.
So India, we were leaders in diabetes. Now we are leading the way in sinusitis as well.
Moving on to snoring, I'm sure a lot of people come to you complaining about their partner snoring and them getting sleepless nights. Is snoring a symptom of something deeper, a bigger problem?
Very deeper. I mean, in a later when I could say that, one patient came to my room, and even before he started saying his complaint, he started snoring, which means he went into sleep. It may be appearing as a joke, but this is what happens when they travel in a car. Because what happens is when they snore in the night time a lot, they slowly move into a condition called obstructive sleep apnea syndrome, where there is no proper oxygenation to the brain and other vital organs. So what happens is once the saturation drops down, the brain will stimulate them and make them awake. So that's why if you ask their partner or whoever is there in the house, they will be saying that there will be, snoring, it will go to a peak, then there will be a pause, then again he will start breathing. Yes. At that one point of that pause period, he will stop breathing also. People used to get scared of that. So once the breathing is stopped, again the brain will, hypoxia is a good stimulator of respiration. It will stimulate, again they will breathe. So what happens is this kind of, this sect of people, they want to get into this deep sleep. See, sleep is the most important part of our life. A person can even avoid solid food and live for years together. So sleep, it is very, very important. So snoring, people initially they were looking it as a light. I mean, they took it lightly.
Correct.
They were only making fun of snoring. But now, thank God, everyone has started realizing that there is a deeper problem in that, and now people have started taking advice for that.
Right. Apart from sleep deprivation, I'm sure sleep apnea has other issues that linger through the day.
Yes.
How does it impact your overall health?
No, if you're deprived of good sleep, your productivity is gone. You will be really irritable. And what kind of productivity you can produce? So the whole energy levels will be drained. You won't be energetic to do work at your working place. So definitely it is very, very important to get it sorted out at the earliest.
Another kind of pollution that isn't spoken about enough is noise pollution. And sometimes it's also self-inflicted when we listen to music in our earphones at very high levels.
Yeah.
Tell us how serious this issue is and how it impacts.
It's really serious, because those certain things, what we have taken it in a very jovial way, Now, because of this social media only, they come to know that it's no longer a joke. It's a serious issue. Noise pollution causes a condition called noise-induced hearing loss. The hearing is one of the beautiful sense what God has given to a person. If you can't hear, you are totally detached from everything. If you are not able to see, you are detached from people. But if you can't hear, you are detached from everything. You can't. It's very difficult to live a life without hearing. So the value of hearing is appreciated only when they lose it. I've seen people, coming and begging, saying that whatever possibility is there, I want my hearing back. See, there are some remedies like hearing aid and all those things, but nothing like the natural way of hearing. Especially this noise-induced hearing loss affects the high frequency, and they can't enjoy any good music or whatever thing. I don't know why people use horn than the gear and the brakes. It has become this thing, and we take pride in having extra horn fitted, and you keep honking. They think that once you do that, people think that you are a big.
But how many people you are impacting around you with that extra large?
See, I'm telling you one simple example. You are honking in a traffic signal where no one has got a choice to move out of that place. See, okay, people who are using helmet are at least protected to some extent. Small kids going to the school, what mistake they have done? They can't wear a helmet, and they are going in the autos or school vans where it is not completely covered, and you are honking and putting their hearing at stake. Who has given you the right is my simple question.
On a day-to-day basis, what can be done by people whose jobs also depend on wearing, say, a headset all day long? What can be done to your ear health? How can it be maintained?
See, earphones are ideally good, I would say. Instead of using the phones directly over the ear, earphones are obviously better. But only thing is you have to be correct in using the right volumes. As I told you now, don't exceed the limit. See, 80, 85 decibels and all. If you're constantly exposing your ears to such a loud noise, obviously you have to suffer. So, because why I told about this direct phone is, when you use the phone close to the ear for a long time, you could see many of the phones will become heat.
Yeah.
It will become hot. Heat is generated in the phones by the battery, and that heat will be transmitted to the ear and around structures. That can cause chronic pain. And of course, that radiation, that radio frequency radiation, if you keep the phone here, it will be here, which can be harmful also. Though it is not so harmful, but again, if you keep your phone away and if you use the earphones, the radio frequency radiation will be transmitted to the phone. And from here, you're taking only the Bluetooth sensor. So earphones, of course, I would recommend it. The other good thing is, by using these earphones, when you travel outside, you can cut off all the external noise.
Correct.
So the recent innovations, they are cutting off all the external noises, which is very helpful. It's a big bliss, I would say. So earphones are good as long as you use the right volumes.
If we can look at the throat, ENT, right? Throat is one thing I don't think enough people speak about.
Yes.
Right?
Yes.
Infections happen, you gargle, it goes away. But what can we do to improve the health of our throat, to make sure there are no infections?
Yeah, the throat health starts from the mouth. See, our mouth plays where maximum organisms, the bacteria and viruses are there as a commensal. So the first step is keeping yourself hydrated. When you are not keeping yourself hydrated, the infection, the infection gets more into they grow more into the mouth and they go into the throat. So the first step is to hydrate yourself well. And of course, good oro-dental hygiene measures, like avoid all any tobacco in any form. Of course, spirit, alcohol, all those things can affect your immune defenses in the throat.
So is it advisable, even if you don't have a throat infection, to make sure that you're okay because you're exposed to all sorts of things?
Yes.
In the night, just drink hot water or just do salt?
Lukewarm water.
Right.
Don't drink either
hot,
too cold or too hot. Lukewarm or room temperature, salt water gargling with a lukewarm water. That is very useful. And of course, steam inhalation also helps you. Similarly, steam inhalation is also a very good habit which will help both in controlling the sinusitis and the throat problems as well.
How important is thyroid for us? The right amount, neither too much nor too less. How can it impact our lives?
Thyroid gland has got very important role in producing hormones, which is very essential for all of us, thyroid hormones. And not only that, attached to the thyroid gland is there are 4 glands on either side, called as parathyroid glands. The parathyroid glands are very important to maintain the calcium in our body. Calcium is very important for bone health. So thyroid gland is very, very important in terms of hormone production. But the most important thing is, the most alarming thing what we are seeing these days is the tumors in the thyroid gland. We are seeing a lot of cancers in the thyroid. So I would advise to tell this precaution, as a caution, if you have any swelling in the thyroid gland in the neck, the front portion of the neck, front anterior surface of the neck, if you have any swelling which is progressively increasing in size, so it's better to get it evaluated.
Detection and treatment as soon as possible.
Don't, whenever you see any swelling, for God's sake, don't do any home remedies. Home remedies you can do for sinusitis, throat infection, some simple infections. Any swelling in the head and neck, for that reason anywhere, don't take it lightly unless the concerned specialist says that there is nothing to worry.
But one cancer that is not so benevolent is oral cancer.
Yes.
And you've been seeing cases increasing.
Yes.
What are the usual causes of this cancer?
Now, unfortunately, India is becoming the headquarters for oral cancers. Normally, over the globe, if you see, oral cancers, they constitute only 5% of the overall cancers, whereas in India, it is 40%. 40% of the cancers in India is oral cancers. In Tamil Nadu also, second most common cancer is oral cancers. Of course, northeast and northern parts, they are even having even more number of cases. We are getting 60,000 new cases every year. And would you believe that almost 3 to 5% is dying every hour due to oral cancers, every hour. As we talk, as we finish the interview for 1 hour, already 3 to 5% they've left us due to oral cancers. And the most annoying and sickening thing is, in India, this oral cancers, people get at a very younger age. In Western countries, they get at the age of, say, 60, 70. Here, right from 40, they start getting. And this is very much preventable. Very much preventable. It is only due to the habits, smoking and chewing, pan or tobacco, whatever. They have a lot of names.
Correct.
I don't even
Gudka, pan,
whatever many
tobacco.
names are there. That any tobacco in any form and smoking will cause oral cancers. But having said that, another thing what I notice is many patients who complete their treatment, oral cancers, after that they think that our treatment is over, and then again they start smoking. Oral cancers, for that reason, even if the treatment is completed, you have 4 to 5% chances of getting some other cancer in that surrounding area.
Right.
5%. It increases by 1% every year. So the best thing is to give up smoking or this thing. And the two lung cancers also very high. Smoking, they say, the moment you quit smoking, in 15 years, the chances of getting lung cancer is dropped by 50%. And in 20 years, they say that you come into the general population who have never smoked. Of course, we are all passive smokers, maybe,
Yes.
But what I mean to say is, the moment you quit, whoever is watching this, if they stop smoking, in 20 years, whatever harm you have done to the thing, it will be reversed. So even now you have a chance
Absolutely.
to avoid getting into any oral cancers or lung cancers.
That's very encouraging.
Yeah, throw it away right now.
So because some people are, there's this doomsday where, I have smoked so many years anyway. It doesn't matter.
No.
Might as well continue. So if you're watching this, you have chance even now. Stop smoking today, and in 20 years, you'll be back brand new, almost?
Yeah, brand new. Newborn.
Doctor, if we can just quickly take a few questions on myths, right? Health myths that we see on the internet or passed down to us through generations. Let's start with pouring hot oil in our ears to clean or anything. Is that advisable?
It's not at all advisable. Not at all advisable, because oil will be a good medium for fungal growth. So you should not use this. And of course, hot oil, as I earlier told you, the skin is very sensitive. It will injure the skin. And if it is too hot, it can affect the eardrum as well. It is not a good habit to use oil in any form to the ears.
Smoking will for sure lead to oral cancer?
Yes.
Or it can be reversed as well, like you just
said.
As
I told you, the moment you stop smoking, the chances, it comes down by certain. There is no exact data how many percentage. For lung, it is there. For oral cancers. But of course, the moment you stop smoking, and give up with this pan chewing, you can start taking some antioxidants and lead a very healthy life. Eat properly, select what you eat, the right ones you eat. You can reverse the damage caused by all this smoking and pan chewing.
Right.
So it's never late.
Right. Sinusitis is not curable is one thing we hear. Can it be treated?
Sinusitis is nothing in a layman term. It is an exaggerated cold, that's all. It can be very much treated. See, as I told you, only if it is secondary to some anatomical problem, like any tissue, extra tissue is there, or any bony deviation, this thing, you have to correct that. Otherwise, simple sinusitis can be very much cured completely. It is not a lingering disease which will be, coming with you all along. It can be easily treated. And of course, some precautions are also there.
And last thing, you already addressed this, wearing earphones, most people say is bad, but you are suggesting wear earphones,
Yes.
but at moderate volume.
Yes.
Right?
Because if you use loud noise, what happens is, one, you are harming yourself, your ears, and what happens is there is something called noise inflation. We call it as Lombard effect. So to overcome that sound, you will be talking louder. You can see people, yelling,
Yeah.
you'll be thinking they're fighting, but they'll be telling, can I get one coffee? They will be telling 120 decibel. Arey, why, man, what, for coffee, why you are, no, I'm okay. So this is the thing. They don't know that they are talking at, so what happens is, one, it will affect your vocal cords. Voice box will go in for a toss. So slowly, that's why, today's world, voice is very important for everyone, because without voice, you cannot survive. Any profession, you need to talk.
That's true.
So voice is the biggest asset for any person, and identity, as always I used to say. So earphones, of course, use at the recommended levels. Importantly, I want to tell about this vocal cords also. This is for the professionals, and for you also as an anchor. You need to maintain your voice. So what the general mistake what we do is, just before the show you drink water. That is not going to help you.
Oh.
Yeah. Because you are not going to, the water will not get entry into the vocal cords. Okay. So vocal cords will be hydrated well only when your overall hydration is good.
Okay.
Overall hydration should be good to maintain your vocal cord hydration. Because if you take water, by chance, if you aspirate, have you ever seen one drop of water going to the vocal cords? You'll be coughing for 1 hour.
Yes.
So now you understand that it won't go to the vocal cords.
Right.
So vocal cords has to be hydrated by general hydration.
So
Drink
last
more.
minute drinking water will not
It
help.
will never
Through
help.
the day you have
It
to
is
stay
psychologically, you will feel that, okay, your tongue has become wet, that's all.
Yeah.
And of course, for voice, all this caffeine products also will affect the voice in two ways. One is by causing diuresis, that is, they tend to urinate more often, which will cause dehydration, and acidity. In today's world, many of them land up with this acidity, what we call it as laryngopharyngeal reflex, where the acid comes into the throat and affects the vocal cords. That is, vocal cords are always like a rose petal. So if you pour acid on it, you can imagine how it would suffer.
Absolutely.
So to maintain that this thing, have proper food at the right time. I don't know whether I can tell this because I don't do that. Being a surgeon, it's very difficult to maintain that. But still, at least let me advocate that. Have proper food and avoid caffeine products and avoid smoke in any form, and alcohol. All these things can directly affect your voice. And other thing about voice is, what I wanted to tell is, if there is any voice change, which is there for 21 days, get evaluated by a doctor. Because as I told you how thyroid cancers are easily curable, there are cancers in the vocal cords which are completely curable. The reason is, in the vocal cord, even if you get 1 millimeter change, any growth, the voice will change. In other parts of the body, unless it grows to a bigger size, you may not notice it. Whereas in the vocal cords, first thing, voice change will be there. So you can diagnose at a very early stage, and they don't spread to other parts of the body most of the time. So when this is one more carry home message.
Right.
If there is any voice change for more than 21 days, unremitting dysphonia we call. The sense your voice has changed and it has never come back to the normal. If it is waxing and waning, then it's okay. But your voice is always abnormal for 21 days. Better get evaluated. It can be simple, right from simple infection to the extremes of thing also. So never ignore that, because
Right.
I'm very fond of voice. That's why I keep talking
Absolutely.
about the voice.
Now, these are very, very useful tips because every small thing can impact our overall health.
Yes.
And I'm sure our viewers will implement a lot of what you've asked them to.
Thank you.
Good habits and good hygiene. Thank you very much for your time,
Thank
Dr.
you so much.
Balaji.
Thank you. It was very pleasure.
Absolutely.
Pleasure. Giving a lot of. I would be very happy. If you can quit smoking and stop honking in the roads.
I would love if you can drop comments, if you will listen to Dr. Balaji and you will implement what he's asking to quit smoking, honk less on the road. If you're willing to take up this challenge, do drop a comment in the comment box.